KPIX5's Andrea Nakano begins our team coverage tonight with a medical expert's reaction to the governor's dire prediction.
There may be some difference in opinion in the numbers that Governor Newsom has released, but they agree on one thing. The virus is spreading in the community, and Californians need to prepare for the worst.
It's time for all of us to recognize, as individuals and as a community, we need to do more to meet this moment.
The governor's order of a statewide shelter in place comes on the heels of his letter to President Trump requesting federal resources. In the letter, the governor says we project that roughly 56% of our population, 25.5 million people, will be infected with the virus over an 8-week period. Those numbers are for Californians alone. Dr. Yvonne Maldonado with Stanford Medicine is trying to figure out where the governor got those numbers.
That may be a worst case scenario, which I think, if I were the governor trying to plan out what I would need, I would want to think about what the worst case scenario might be.
Dr. Maldonado says health experts are learning more about the virus daily. There are 7 different kinds of coronavirus. 4 of them have been around for a long time, causing the common cold. All of them come from bats, but COVID-19 has some unique characteristics. It lives mainly in the nose and throat and has a higher mortality rate. That's why doctors say this virus shouldn't be treated like the chickenpox.
So you have a 1 in 100 chance of not surviving that infection. Now, of course, that risk is higher if you're in a high-risk group, but do you really want to expose yourself to a 1% chance of dying from this virus?
Dr. Maldonado says there is a possibility that, unlike SARS, which went away after a few months, the coronavirus may return later this year. There are many antiviral studies underway to fight COVID-19, and Maldonado hopes a vaccine will be out in about a year. Until then, the best weapon against COVID-19 is isolation.
The point of the stay-at-home order is to make those numbers moot, to bend that curve. When we say bend the curve, that means the projection no longer becomes a reality because we changed our behavior.
Dr. Maldonado says a big portion of those infected will not show any symptoms. That's why it's even more crucial for people to stay at home so they don't unknowingly pass the virus on to others. In Emeryville, Andrea Nakano, KPIX5.